Okay. Thank you. So yes, Dr. Clements, thank you for joining us today. I have your presentation if you need me to share it for you, but we will make a start and I'll hand straight over to yourself.
Thank you. So really nice to see everyone and lots of people. I've just seen that Lindsey Sutherland's arrived. She works with me on the sustainability program for the ICB. So hopefully she'll chip in or certainly contribute to conversation at the end. And I do really hope that we can have a bit of a conversation at the end of this. So I talk a lot, so somebody start shouting at me if I'm talking for too long. But I'll try and get this done in half an hour. So I will start by sharing my slides if I can. See where we're at. Managers. It's going to be it. Check. No, this is you. So you can see from my very busy thing that I make a lot of. I think I'm going to ask you to do it for me, Emma. Is that all right? Sorry, just in
Yeah, of
case
course.
otherwise I'll just waste too much time. So as well, Emma brings up my slides, I will stop sharing if that's okay. So I'm a paediatrician at King's Mill Hospital. And I wanted to talk about climate change and health and the opportunities in primary care. And I see practice managers being really key to this. And Jen, forgotten her surname, Jen is in the
Moss
LMC.
Langfield.
Mars Langfield actually set this meeting up. I don't know whether she's here on the call, but she was very keen for me to come and talk to you because probably you've got more power to make change than GPs have. So that was her thought. So yeah, I've been a consultant paediatrician at Sherwood for more than 20 years now. I'm now associate medical director there, and I have a bit of an interesting portfolio. So I think quite a lot about end of life and respect, Safeguarding and Mental Capacity Act, so really vulnerable patients. And that's because I've looked after very vulnerable children with complex disability. And then in my portfolio is climate action, which I've been doing at Sherwood for about 5 or 6 years now. And alongside Lindsey, who's on the call, I'm the clinical director for the Knots Greener ICS. And this is a group of us working to really share knowledge and try and help all of us to reduce our carbon footprint. So the ICS has a green plan, as does every trust. And I don't know whether general practices have a green plan because you're all individual, but I would put it to you that it would be a good thing to do if you don't have those already. And I'm also, because I'm very noisy on this subject, I'm also the Officer for Climate Change for the Royal College of Paediatrics, which is a national role, and that's really exciting. And means that I get to know what's happening in other colleges. So I certainly have links with the Royal College of General Practitioners, Greener Practice, through my personal interest and also through my college role. Next slide, please. So this is a bit of a challenge this is a question that came into my head about 6 years ago. What's the point in saving children's lives as a paediatrician if they don't have a future? And that's because I've been thinking about climate change for longer than most people, and also because at that point I became a grandmother. I also have 3 children, and the sort of numbers coming out of the International Climate Change Committee was really very, very worrying, and really saying we need to do something. And I don't know whether any of you have had those kind of thoughts. Um, it's a pretty negative place to be, and actually my response to that is action. And so all of those hats have happened because, you know, the most important thing I tell people, the most important thing I can do before I die, and I'm sort of pretty old now and I'm half retired, is exactly what I'm doing just now, is to talk and try and encourage people to act alongside me and Lindsey and other people who are already acting on this stage. Next slide, please. So why am I here at the Practice Managers Forum? Well, 90% of NHS contacts are in primary care, so you're really key. And your carbon footprint, the primary care carbon footprint, is makes up 23% of the total NHS carbon emissions. So, you know, you're big fish in that carbon pond. And 60% of this comes from clinical aspects such as prescribing medicines, metered dose inhalers. So the things that doctors like me and GPs and clinicians do is 60% of that. But the other 40% are things that you may have more control over. But I would put it to you that because you're managing the practice, you do have a direct input on that 60%, which is clinical. So the rest of your carbon footprint comes from non-clinical, such as your building, your energy, patient and staff travel as examples, food. So quite a lot of that stuff. And I'll show a pie chart to look at that. So we in the NHS and you in primary care are a big part of this nation's carbon footprint, but you're also a big part of the solution. And for me, that's the bit, the solutions based, the action. Next slide, please. And, you know, we need to start with that acknowledgement that we have a climate emergency, and there's nothing more in your face than what's happening in Los Angeles at the moment. So that has led to loss of life. It has displaced people from their homes. And I have a contacts with the population of refugees that are coming into Nottinghamshire and their health needs and their social needs and housing needs. And I want you to just be mindful that there are 100,000 climate refugees in Los Angeles. You know, we think of refugees as people who come in boats, who are wanting our services and our money, and you know, there's a very negative portrayal of that. But those people in Los Angeles are also climate refugees, and maybe we'd think a bit more kindly to the people reaching our shores if we thought about them in the same way. So climate emergency is a health and it's an ecological emergency. And that ecological bit is something that's a bit underplayed. But if we lose our species and our biodiversity in our gut or in our soil, then actually we will have even more health impacts than we've already got, and it will contribute to that health and climate emergency too. So we can't deal with these things in isolation, and I just wanted to bring that across. Next slide. So what are the impacts on health? And the other thing I wanted to emphasize is that I've done a lot of talks like this to doctors and health professionals because we're health professionals. And so, of course, we're interested in health. But I would put it to you that you as people and wives and partners and parents and grandparents and children yourself also need to know about what are the impacts on health for you as well as for the health service. So we are hearing obviously in Los Angeles about the fatalities. Those people who've lost their homes will be having significant mental health impacts from the distress of this, as do all climate refugees, people who are impacted by severe weather. The people in Nottinghamshire who have been subject to flooding, what's that doing to their physical and mental health, I would ask. And once you've been flooded once, you're going to be thinking, when's this going to happen again? Because it will happen again, won't it? You know, these aren't just one-offs, one in 100 years. These are happening repeatedly in Nottinghamshire. What we also know is that we've got increased or significant air pollution. We're trying to address that, but that impacts on asthma and cardiovascular disease. And as our climate changes, we're having more trouble with those cold, damp, not so cold, damp, wet winters, which impact on mold inside houses. So air pollution isn't just outside, it's indoors as well. There are going to be and are changing vectors are diseases brought by insects and animals, and we're seeing particularly insects. So malaria is moving north. We've got these other dengue, encephalitis kind of viruses and things as well. So these are all marching north as temperatures rise. Increasing allergens, problems with water quality. So when you have flooding, the water systems are polluted by sewage, and that has impacts on water quality. Now we have got really good water systems and ways of cleaning our water, but there was I think somewhere down at Portsmouth had problems with polluted water, and people were having to drink water from bottles. This is a global problem. Malnutrition, what we think about is about people's not being able to get food, and that globally is a major problem, and we're very dependent on imported food in this country. But actually malnutrition in the UK is about obesity, and that changes the patterns of disease. So we've got increasing acquired conditions like type 2 diabetes, COPD is obviously air pollution, smoking and things. And then we see increase in death rates and hospital admissions and mental health crises in extreme heat in this country. That's been measured in Nottinghamshire, as well as the migration that we talked about. Next slide, please. So all of that is not just for me to care about as a doctor, but it's about all of us to care about and be concerned about for our own health and our children's health. And this pie chart looks at the whole of the NHS. So the blue bit is what I do and health professionals, nurses, pharmacists, and what we do to contribute to that carbon footprint. It's our medicines, it's our disposables, it's our consumables. And the green bit you might be more interested in, which is the building energy, the water and waste. The anaesthetic gases is obviously something for hospitals, but the metered dose inhalers are very much part of what comes out of general practice, and I'll talk about that a bit more. And then there's the travel for ourselves, for our procurement and logistics, and for our patients. So there's a green part of that as well. So you could, if you put that into a primary care pie chart, it would look pretty much the same. There's a few differences, but not much. Next slide, please. So just think for a second about what this baby's future might be like. Just going to give you a pause and take a mouthful of my coffee. So where you are on a climate aware journey might depend on how you think about this. And often people feel despair. You know, what is their future going to be like? If you follow the climate statistics, it's very easy to feel despair. But what we know about climate anxiety and all of the things I've told you about the potential changes and the very likely changes now, because we haven't done enough yet to stop it. But we could put a positive spin on that, and what are our opportunities to start thinking about healthy population and a healthy planet rather than focus on ill health, which is what you would do and I do most of the time at the moment, because that's where the pressure is. Let's change that to a hopeful position and start to do action. So that's very much why I'm spending an hour of my time talking to you, and I hope that you'll find it useful. Next slide, please. So I'd love to be lazy. So a lazy paediatrician doesn't have very much work to do. We haven't got big waiting lists, we haven't got backlogs, and everything's going really nicely. And for me to be lazy, we need healthy children. And to have healthy children, we need them to be healthy, of course. We need them to be immunised. We need to have a healthy diet. And a healthy diet is actually defined as a plant-based diet, and I'll come back to that because it's going to be an important part of what we do going forward. So our children will be most healthy if they have a predominantly, not necessarily totally, but a healthy plant-based diet. We need good dental health. We need access to green spaces. And as prescribers, we need to be able to prescribe those if those aren't there already. We need clean air, and we need children to be in school, because if our children are in school, then our adults are able to look after their own health and be at work. And our staff, if you're thinking about your staff, if my children are at school and then I'm at work, and that's a really, for me, that's a really significant driver. And we had a long conversation this morning at the hospital about why staff don't get the flu vaccine. I don't understand it, but you know, there's a lot of things in there. Next slide, please. And I would imagine that all of you would like your primary care, your practices to be a bit less busy, for us to have time to have a cup of coffee and to join a meeting like this, rather than feeling like you don't have time. And most health professionals don't have time to do anything than just churn through patients. And I think you're dealing with that all the time. So all of the things I just listed, I'm guessing that when you think about it, you want that too. And, you know, we need primary care to focus on health promotion and public health, which I know you do. But when you're fighting through lots of demand and unmet need, it's really hard to do that. And that's true right across the health sector. And we need your staff and your services to be resilient. And I'm going to talk about a bit that, because that again is very much what is in your power to give. So we need a prescription for a low carbon future. Next slide, please. So what is resilience? So I don't know whether you know whether your practices are at risk. Are they at risk of flooding? Have you already been flooded? How are you resilient against extreme heat? And have you thought about your supply chains? And then if you drill down to your staff, you know, what is your risk as an individual member of staff and each of your staff members to flooding? Because if their houses are flooded, they're going to be in trouble. Are they going to get to work? Can they get to work? What are the impacts of climate change overall on your staff? Just being selfish, you need everybody to be at their desks, don't you? And then what about our patients? Can they get to your practice? What is, you know, have you modelled increased demand in the summer, for instance, when you've got heat stress? We obviously know about winter and those changing patterns of disease I've talked about. Next slide, please. So just on your energies, your building energy, which is very expensive, massively expensive in our hospitals, you know, we have to start with the low-hanging fruit, insulation. Have you been up in the loft? You've probably got, I don't know who does your estates, but they've probably been in the loft, but is it this deep rather than this deep? Because it's so cheap and it makes massive difference. Ventilation is a vexed question. You know, have you got good ventilation? Could you use a heat exchanger to conserve heat but still keep things, they're very cheap and low energy actually. Have you thought about that? Have you got passive cooling, so moving air through a building without actually using air conditioning? Have you thought about shade? There's lots of different kinds of shade, which includes trees which cool themselves and improve air quality. So have you thought about that? It's a bit outside the building, but we should be thinking about it. Have you got LED lights? Hopefully the answer is yes, but if you haven't, again, the payback time for this is very, very short, less than 2 years. It's really good value, and it reduces the amount of heat that's going into your building in the summer. So really good thing to do. We're just doing a project at the moment about computers, just setting them so they automatically go into sleep and hibernation modes. Our IT department at Sherwood has halved their electricity bill just in that department by just setting them so they do that. And we can also reduce screen brightness. So my computer at the moment is set at 40%. I didn't know it was set like that. I certainly won't be putting the brightness up. You could all just change it while you're sitting here talking to me, and I bet you won't mind. You won't notice the difference. It reduces energy. How many computers have you got inside your practice? So then there's the green energy tariff. I'm going to come back to that. You may be paying for that. It's possibly more expensive and maybe you're not, but that is a really important action. And can we transition to using electricity for water and heating? Have you been thinking about ground source heat pumps and PV energy production? We have tried in our local practice, and I won't name it, to offer community PV panels on the roof, and for many years, and the answer has always been no. It's too difficult because they don't own the building. I understand that many of you don't own the building, but let's find ways to do things rather than reasons not to. And water, you could apply the same kind of logic to water and thinking about transport. Next slide, please. And then there's your supply chain. So 25% of the total NHS carbon footprint is drugs, especially in inhalers. So there are a number of projects in primary care. The ICB is just launching a pilot to only order what you need. So rather than have everything on a repeat, just doing some comms. So I'm hoping that you will hear about that pretty soon, but we could be more proactive. If you've got staff doing home visits like district nurses and people like that, looking at medicines cupboards and looking at what is stockpiled there, which is not being used, which is being wasted, which is still coming in on repeats, there is work that we could do there. And thinking about waste. So drugs is a particularly an area of really high gain. And then you've got all those consumables. And we have a fellow nurse in West Bridgford who is doing working with Lindsey and I, looking at some of those consumables that are coming out of your practices and going into homes and could be slimmed down and will save money and carbon. And then there's all that whole life cycle considerations. The good news about that is that all of those organisations which produce our stuff all have to have green plans and are working independently on that. So there'll be a lot of competition. So in a sense, we can sort of park that, but it's always good to ask the questions about packaging and that life cycle stuff. Next slide, please. So I just want to play this video. I haven't got the thing. If there's a, can you make it work? Thank you. Just to illustrate consumables. Thank you. We haven't got any sound, Emma.
I'm not sure you need sound. To be fair, it's more the visual, isn't it?
So yeah, that's fine. Whatever works. The sound for this bit is the beating heart that you hear on an ultrasound scan for a baby, actually. So Emma, thank you. You can stop that and go back to the slideshow. Thank you. So this is an artwork done by a Dutch artist, and she's done a number of these films detailing the amount of single-use items that are used in an operation, or a baby's been born, or something happening in ED. We have the slides back. You're probably just doing that. Thank you. So I don't know how that made you feel, but it's pretty shocking to see that. And all of that waste you are in charge of getting rid of if it's happening in a general practice. But it's also all of those resources that we are using and then dismissing. Have you lost my slides, Emma? You're working on it. So thanks. So prescribing, so a lot of that stuff is used by clinicians, but we all need to be thinking about single-use items and how we do that. So in general practice, you know, a really good example is I forgot what it's called. The thing you use in gynae, not a colposcope, but the little one.
Speculum.
Speculum, thank you. Speculums, which were all used to be re-sterilised and are now single use. And I know there's lots of, oh, we can't because we haven't got sterilisers anymore and stuff like that. But we need to start thinking, how can we, rather than have single use items. So prescribing is really, really important. And there's lots of work going on that, which may not be your bag, but you certainly need to be aware of. We need to be better at empowering patients so that they know what to do, so that we don't have to keep asking you, and using really good evidence-based medicine. So inhaler, the talk about inhalers is really, really important, because the new evidence is about, you know, smarter prescribing. So we reduce mortality and admissions and keep people at work and healthy, but actually it's a low carbon thing. We need to talk about end of life and respect, so that we don't have people coming to hospital to die when they want to die at home. And that's not only is it better for patients, but it's better for all of us. But we then need to plan that and do that well. We need to think about those green prescribing offers, which are cheaper and more effective than drugs. And we need to help solve their problems. So at Sherwood, we now have the Citizens Advice Bureau for staff, so that we can stop them being stressed about money and think about how can we help them, so that they don't just go off with stress and have time off work and a load of antidepressants. We actually help to solve the problems at the beginning. And I know that's simplistic, but actually it's that kind of approach we need to take. What are the roots to these issues? Eating and obesity is another thing. You know, we need to get there before we get to that point, rather than try and solve it after the horse has bolted. And can we do more to use your waiting rooms and our waiting rooms to share information about public health? So if you spend 4 hours in ED, we should be doing something very useful in that 4 hours while you're waiting to be seen. It'd be better if you could be seeing fewer, and it'd be better if we had fewer patients coming in the first place. Next slide, please. So we're talking about sustainable value, and if you just think about an outcome for a patient and the financial impact, which is really where we're pushing so much, then you know we can do an operation, or we can do an intervention, and we can cost it. But what we need to be thinking about is that action what we need for our whole population, and what about the environmental impact and the social impact? And we're beginning to develop QI projects to look at that. And we really, really need to do that in general practice. And Lindsey and I are very keen to do that. Next slide, please. So I would imagine, I don't know how many people are on this call, 39 people are on this call. So I would think between 15 and 20 of you have an inhaler in your pocket, in your top drawer, or somewhere in the kitchen that you use, and probably another 5 of you, if I've got the numbers approximately right, will have somebody else in the family that has an inhaler, and they contribute 3% of the total NHS carbon emissions, and particularly the MDIs, so the puffer that you can see, the salbutamol puffer there. So the DPIs, the dry powder inhalers, are in the other circle, and they don't use any propellants at all, and so they're much, much greener. Next slide, please. And you'll be able to see these slides afterwards. Emma's got them, but the very fancy puffers, Symbicort, Flutiform, these are expensive, and their carbon impact is really high per inhaler. Salbutamol is very high as well, so Ventolin particularly in the bigger puffer, big carbon impact. And actually, if you're using a lot of the blue inhaler, that tells us that your asthma is not well controlled. And the new guidelines that came out just before Christmas really are trying to do away with using Ventolin at all, but using a Symbicort DPI. So these ones right at the bottom of the slide here that have got a very low carbon impact but are very effective at asthma management. So there's a whole new thing that you need to be ensuring that your GPs are following for the because it's good medicine, but also it's green medicine. Next slide, please. And then where do these inhalers go when you've finished them? And if we're putting them into our general waste, the gases in there, which will still be there even when the inhaler is empty, will continue to leak out and cause a significant carbon impact. Whereas if you return them to a pharmacy, and most of your practices have pharmacies in these days, they can be disposed of safely, which denatures those very, very bad greenhouse gases by high temperature incineration. So it's really, really important that we do this, so that you do it if you're one of those 15 to 20 people who has an inhaler themselves, or if you've got somebody in your family, but that we're also telling our patients. Next slide, please. So this Our Health, Our Planet is a really great website, and I would really encourage you to use the QR code or look it up. It's very easy to find, because it's a sort of a synopsis of all of the different specialties, including general practice, and what we're doing in terms of sustainable QI and why it matters. And a third of this website is for ordinary people, and of course I'm an ordinary person. I need healthcare, so it's got guidance for ordinary people, and then there's specialty specific guidance, including managers. So I don't know whether Lindsey's seen that. It's sort of high hitting, but actually you're the practice managers. It's got some interesting prompts in there. Next slide. And what that says these are the highest impact actions. So there's non-clinical, and I'm going to come back to money and energy in a second, and food. So those are the most important things you can do that are non-clinically, that you as practice managers can do. And then there's the clinical stuff, which you also contribute to, which is about inhalers, it's about diet, and then doing other sustainable projects. Okay, and there are toolkits that help you do that. Next slide, please. So Our Health, Our Planet is a great resource. We've got Greener Practice, which is also a great resource with loads and loads of ideas and worked QI projects. The RCGP are really active, and they've got a toolkit, and the Centre for Sustainable Healthcare is there. This last link is about banking, and I will come back to this. I've also got it in the slide where it's relevant, but money is really important. Next slide, please. So what I'm trying to show you is a vision for a healthy, low carbon future. And I hope that some of those things have inspired you. Next slide, please. Because we have to have it. If we don't, we've already missed that 1.5 degrees target, only just. And we're a very, very long way from keeping it at 1.5 degrees, which we've just crossed. But it's only going to happen if people like you and me make it our business to change. We need that investment in renewable energy, and I'll come back to that in a second. We need to argue for access to green spaces, because that will keep your patients healthy. It will keep my paediatric patients healthy. We need to move to a healthy low carbon diet. And we need to be thinking about all of those other things which might not be directly related to you, but certainly are when we start to think of ourselves as part of that health community that Lindsey and I are working with. And if we did all of that, we would have a lower incidence of preventable conditions such as type 2 diabetes and obesity, COPD, and improve mental health, not just for our patients, but for me and for you and for our children and our grandchildren. Next slide, please. So these are the top 3 personal and corporate actions. And they're not health actions, they are things that we absolutely have to do. So where is your money? And I could ask you as individuals, and look you all in the eye, where is your money and what is it doing? So that link is to ethical and sustainable banks. And I played around with this last night. So if you go on that link or put Bank Green, you'll find it. And if you put in the UK and you put your bank in, it will tell you where it is on the dial from red, which is hideously bad, to green. And the average is somebody like NatWest and the Royal Bank of Scotland, because they're actually the same people. I didn't know that until yesterday. And they're averagely green. So they do quite a lot of good stuff, but they also put money into fossil fuels. And so directly, by putting money there, they are fueling that temperature rise and climate change. And there, you know, where the money goes is where things will happen. So if you put Barclays in there, or HSBC is pretty bad as well. They're right at the red end. They're putting trillions of dollars into oil and gas exploration and fueling the climate crisis. So if your money is there, or your practices money is there, please think about moving it. That is the most important thing we can do to save our children's future. The second one is energy. So if you buy energy from a green, sorry, I should tell you that places like the Co-op Bank, Nationwide Building Society, Triodos Bank, you'll see them in the website. Those are right on the green scale. No money goes into fossil fuels. That's what we should be aiming for. Energy, where do we get our energy from? Now, I'm not saying that my trust has got green energy, because I know it hasn't, but we need to move to green energy suppliers, and that is easier as individuals. In your household, in my household, I have a green energy supply, because if I don't have a green energy supply, my bills are going into oil and gas, into brown energy. So think about that for yourselves. It might be a bit more expensive, but it probably isn't. They're doing really good deals, and move your energy into green energy, because then all of their profits will go into renewables. At the moment, British Gas, for instance, they do renewable tariffs, but their profits will be partly going into oil and gas, if that makes sense. So energy is really important for yourselves and for your practices. And then food. Food is medicine. We should be prescribing a plant-based diet, because it's the best thing we can do for our health, and because food is contributing, a meat-based diet, a meat and dairy-based diet is contributing massively to climate change. That I could spend an hour talking about that, but we need to think about food. So it's not about public health. These are all public health message, but these are the things that we could do. You can do in your practices. You could talk about food as a practice policy. We can talk about it with our patients, and we can make the change ourselves. This doesn't need to be 100%, but an 80% change would be massive. Next slide, please.
Have you many more? No,
that's it.
I'm going to say
me
not
done.
many more
So
slides.
lots to think about. Lindsey is just chipping in. So Lindsey, but please, I'd love us to have a conversation. And what can Lindsey and I do to help you move these things forward? So Lindsey, do you want to just chip in? I've done.
Yeah, no worries. And I shan't say much, because as always, Helena has been very comprehensive in their presentation. I think, unlike Helena, I was made program director because I had capacity, not because I was passionate and I was living a kind of, climate considered life. But in the last 3 years of doing this, my life has absolutely changed. So every little bit of information that I learn, I can act on now, which is great. And actually, I'm a bit upset that I've just found out my bank is one of the worst banks. So you see, we learn all the time, but information is power, and that's the purpose of today. And hopefully, you'll all go home and maybe tell one of those facts to 2 or 3 people, and so on. And that's such a powerful thing. Having carbon literacy, as it's known, is probably the single thing that we could do very easily at no cost. So I won't say any more than that. I think it's just an opportunity really to open for discussion, really. If you have questions or observations or any kind of things that you've thought about today while you've been listening.
Thank you both for coming along today. One of the questions I was going to have was, what, practices are very busy. This is potentially quite low down on their things to think about and to look into. And so what are sort of quick, easy wins? So those 3 examples you provided at the end are really good. But are there any sort of ready-made resources, posters that can be put up in a waiting room that practices don't have to design themselves?
Absolutely. So that's where you go to the Your Health, Your Planet, or Our Health, Our Planet, or you go to the RCGP website and just have a scroll. And Greener Practice. Greener Practice have been doing this for nearly as long as me. Yeah, there are loads of resources that you could just get out there. So yeah,
but if it would
reinvent
help, we could take a selection and send those over to you, so that they're there and ready. But yes, absolutely, try and tailor it to what you think is important.
And I think the other biggest, the lowest hanging fruit in that clinic, those three things are absolutely vital. And I will be checking with Lindsey how quickly she's changed her bank account, because I know she will. But it's actually very easy as individuals, and there is support, particularly just from the Co-op Bank. They support businesses to move bank accounts as well. It's not that difficult once you've made a decision. The most important clinical thing is the inhalers and asthma care, because not only is it better for patients, it's better for the NHS. It will reduce mortality, it will make them healthier, and it's the most important single intervention that we can do. And I know your GPs are aware of that, but there's new guidance out to help, and we need to educate patients. The recycling, not recycling, but bringing back inhalers to be destroyed. Joining up your pharmacists and your GPs, really important. Perhaps you do that, but if you don't, that's very, very important. Hopefully that's helpful. Yeah, Lindsey, maybe you could take that as an action to just come back with some really, top images, and maybe that's something that you can share between yourselves as well. If you find a really great one, this is really great, let's all do that. Just do it, please. It would be great.
Brilliant, thank you. Yeah, I can see there's been a question in the chat for any process for the waiting rooms to advise about the inhalers taken back to the pharmacy. So Lindsey, if you could share that with us, we can pop it in our newsletter so that everyone's got access to that. Thank you.
Fantastic.
And so Debbie's put in there about speaking with infection control people. She's put speak with IPC, so wasteful. Daisy grips tourniquets.
Yep. Yeah, great. I'm glad you know about those, please. So there's been a lot of work. So again, there has been work at NUH trialing those. So the phlebotomists are using them. These are reusable tourniquets. So Lindsey, whether we can ask Sarah to help with this, there's a whole load of SOPs about daisy grips in hospital, which we can give you, and you can look at them and say, oh, can we just roll this out? Absolutely. So yeah. So these are small things, but they add up. And these QI projects are costed. Nearly everything that you do will save you money. And can I just mention about IPC? So infection control is often used as a barrier to change. And there's a national association of greener or sustainable IPC nurses who are really working on this. So reducing glove use. You don't need to wear gloves unless you're doing something invasive or directly in touch with things, and we're very bad at that. You could look at the gloves off campaign. Yeah, so there's things around this, but yes, please. All of these QI projects are out there. We don't have to start from the beginning. They've been tried, they're tested, just do it. And I would really encourage that. We haven't got time to keep reinventing the wheel.
Great, thank you. Are there any other questions or comments at all? Lindsey, it might be helpful if possible. I don't know if practices have your contact details or who the best person to contact is. So if practices were looking to maybe make some changes or maybe needed a bit of support in exploring this, sort of who is the best person at the ICS to speak to about that?
Yep, that's absolutely fine. We do have a generic mailbox for this, which I will put in the chat now and include as well when we come back with the slides and so on.
Brilliant.
And just to say that Lindsey and I have a clinical advisory group, and we don't necessarily need to expand that, but there are a group of us who are particularly trying to support this, and Lindsey and I are actively trying to get some general practitioners to do fellowships so that we can really develop this and roll stuff out. But GPs are only a small part of your whole, and I think that's the other bit, is the thinking of it as a team. It's a team sport. It's an MDT, which definitely includes your management. So yeah. And I think we need to find opportunities. So if you want us to come back and talk about, or somebody that we can share, give to you to do another session in 3 months' time to keep this moving, that would be great. Would love to do that kind of thing.
Brilliant. Thank you.
And just one final word from me as well. We are not asking you to do something different. Oh, well, we are asking you to do something different. We're not saying here's yet another thing to add on to what you're doing. It's every little thing that you do will add some value back. So never think it's too small. What's the point? But yeah, we wouldn't really want you to think, well, on a Monday we're going to have to suddenly start doing net zero now and thinking about climate. It's just thinking around it all the time in everything that you do. If you're throwing something in the bin, what is it? Did you need to do that? Can you save money by having a reusable version of it? Things like that we're asking you to think about, please.
Thank you. Thank you both for coming along today. We'll share the slides and the recording in our newsletter. If there's anything that you're more than welcome to come back, or if practices have questions, we'll certainly pass them in your direction. So thank you very much for your time today.
Okay. Thank you. Shall we drop off? Have you got other stuff that you want to do? I know you haven't got much enough time.
Yes, if that's okay. Thank you.
Of course, yeah. Thank you very much. Thanks for having us today. Cheers. And we'd love to have feedback. It would be grand. Cheers. Thank you.
Brilliant. Thank you.